there's nothing great about Great Britain these days, as you know, but in the whole, that is the population of Great Britain. Now, and India's population, as you were saying, is over 100 million of the over 60s. Now, there are great differences, cultural differences between India and the UK. UK relies on statutory services such as the National Health Service, and we have purpose-built accommodation for the elderly. India, on the other hand, still has close-knit communities. Communities here are fragmented, and families are not as networked. There are broken families in the UK. So, so the elderly, of course, rely almost exclusively on the NHS. Dementia is a big problem here. About 1 million people suffer from dementia, and we call it an epidemic of dementia in the Western world. People rely on medication in the whole range of mental illnesses, and this has got worse with COVID-19. So in the elderly alone, prescriptions have gone up 7% between March and April 2020. So our lockdown happened on the 17th of March. Your lockdown happened on the 25th of March. We were a week earlier, but then we have the highest rate of deaths anywhere in the world per population. Our total deaths at the moment are about 38,000. So 25% of deaths in nursing homes occurred in the first few weeks, and 45% of all coronavirus deaths have occurred in care homes. And we'll come to that, I'm sure, in a minute. So what are the immediate issues, as you were saying, that we have from coronavirus? Well, in the elderly, that is. So in the elderly, so social distancing is a real problem because they have multiple problems. Some might have dementia, some might have arthritis. A lot of people live in care homes or sheltered, what are called sheltered purposeful accommodation for older people, where it's not like a, well, by the way, nursing homes here are nursing homes for older people. In India, nursing homes are like mini hospitals, but in India, in the UK, nursing homes are not hospitals. They are really specifically for people with mental or physical problems. And they are long stay places generally. So the elderly face, of course, a number of challenges. I don't think the elderly are that fearful of coronavirus generally, although you see the range of mental illness, anxiety disorders, depression. I had a chap the other day when I was on call. He was 78. He turned up in casualty and he said he feels suicidal because he's going to die from coronavirus, and so he might as well kill himself. He'd had a history of depression, so he got completely morbidly depressed about it. Of course, the last thing you want to do is admit patients. We treated him in the community successfully, and he's okay now. But and of course, psychosis also is a problem. But I found that people fall into a thirds. So a third of people are really quite upset about the lockdown because these are largely people, elderly people who are in the community, who can't see their family, can't see their grandchildren, can't talk to their friends, and you can only WhatsApp videos so much. That physical contact that elderly people seem to be more needy in terms of emotional need, and so a third of people have really felt it really badly. A third of people have been neutral about it. It's come, so it'll go. But a third of people have actually quite enjoyed it because they've been in isolation anyway. So it's not really impacted on them greatly, and they've seen that it's a lot less hectic around them. So they felt okay about it, which is funny, isn't it? But they feel that isolation is not something that they have had any major issues with. I need to pass on to the other panelists as well. Was there anything I wanted to say on that? And the other point you asked was about whether the older people, elderly people, have despised other people who've been not so affected by lockdown, who can get out and about. Well, generally older people might be a little bit intolerant, but they don't feel those strong emotions of hatred and anger in that way. So they have more of a communal spirit. They are a little bit more sanguine about it. In fact, much too sanguine, because all these deaths have happened. And earlier on, there was no outcry amongst anybody about the deaths in UK. So thank you very much.
Okay. Thank you, Professor Bamra. I mean, there's a lot of questions that would be coming, and probably I would make comments to what you mentioned because I put it in the question somewhere else. I mean, so we'll discuss about it more probably at the end. So the next question is for Dr. Chandrasekhar. Um, Samir, have you put up the question? So for Dr. Chandrasekhar, I would like to ask, as in there's so much going on in the social media, all the sensationalism and everything. How should the elders react to this, and how is it actually affecting their health, their mindsets, and what should be the right way? As we discussed, there are different subgroups, so I would also like to know more from you about people who have pre-existing mental health conditions, be it anxiety, depression, or dementia, and also probably the onset of new conditions that this crisis is probably bringing on in this age group. So if you could enlighten us with that, please.
Thank you, Daljeet. Am I audible?
Yes, you are.
I don't have any slides anyway, doesn't matter. See, in the last 3-4 months, we have been witnessing an unprecedented pandemic, which is occupying most of our conscious time. In fact, you take any media, whether it be TV or WhatsApp or Facebook or whatever media one is using it, or including the print media, there is a plethora of information. And how much of this information each one of us are able to really distill and really assimilate? I think in the underlying, this is a very important question. A lot depends on how we take this information and apply it to ourselves. One of the main problems is that there is a lot of knowledge around, but no one to really tell that this is what you have to do and what you ought not to do. One of the things which I personally advise is that most of us, I consider myself as also an elderly person, most of us should stop really looking into too much of information as far as COVID is concerned. Because once we start ruminating about this information, probably we tend to get more and more worried. So best part of it would be to get the information from a reliable source. And who would be the reliable source than your trusted physician? Just ask him what information is needed as far as this disease is concerned. Remember that it is a disease and you need to get a proper knowledge and advice from your own physician. Having said that, most of us have a lot of resilience. People above 60, 65 years, or even elder than that, have seen so many adversities in their lives and faced so many adversities with reference to health, with reference to famines, with reference to floods, so on and so forth. So this is probably another phase which probably goes off in few days. And I do understand that a lot of the people do have this resilience. But however, what we need to understand is a cautious optimism. Cautious because we need to take precautions so that we don't get affected by the disease. Optimistic with the feeling that it may not really pose a great problem to all of us. Another issue is that with reference to this information is how we react. Is that most of elders know that they have certain comorbid conditions like say depression, health conditions like hypertension or diabetes, and they are more vulnerable. So this vulnerability fact should be kept in mind and they should take adequate precautions to see that their health is maintained. In this age group, usually in the elders post-retirement, psychologically speaking, we pass through a phase, two phases. Pass through a phase of what we call, psychologically speaking, a phase of integrity and despair. So this phase actually stands out in the sense that some of us, some of the elders, look at their past with a sense of satisfaction, a sense of achievement, that they have done well in their lives. And this is another phase which they are going to sail through. But there are another set of thinkers, another set who pass through the phase of despair, wherein they look more pessimistically to their past, think that they haven't achieved much in their lives, and this is another doom which they are going to face. And this sort of a psychological makeup also does make some sort of a effect on the way the person views this pandemic. Then there are two categories of elders when it comes to the question of health, and especially mental health. It's known that 10 to 20% of the elders do have certain mental health issues. So we look at two groups now. One group is that who have a pre-existing mental health issues like anxiety, depression, dementia, and so on and so forth. There's another group who do not have any mental health issue in the past, but owing to this sort of a information which they have gathered, they undergo some amount of distress. And what are these symptoms of distress? These distress symptoms are mainly centered around not able to sleep well, becoming very anxious, feeling bored and dejected, or certain times having certain panic attacks, suddenly feeling that everything is going to come to an end, the heart beating fast, sweating, and a sort of a restlessness feeling, and fear of contracting the disease from someone else, and also fear of spreading the disease. And ultimately, the fear of death and dying. All these things, emotions, do impinge upon people who get this information about this pandemic. But more challenging is those who have the pre-existing anxiety, depression, and dementia. So they have to be in touch with their mental health professionals, whoever it is, and try to see that they continue their treatment, they continue their counseling sessions, and adapt to the situation. The more problematic, and really my heart goes out to those families, is those families who have a patient with dementia. The problem is that a person with dementia does not recognize that he is ill. His cognitive, that is his mental abilities to remember, to do things, to manage himself are grossly impaired. So this individual cannot really comply with so many conditions you're putting, like keep your hygiene, don't go out, you should not wander away, you should remain at a place, you should follow some hygiene measures. All these things are impossible for the patient of dementia to comply with. He doesn't understand them basically. So in that circumstances, the family or the carers who are under tremendous pressure, they have to take care of themselves, they have to take care of this person with dementia, to maintain his hygiene, to maintain his well-being, and this is another challenging issue. So basically, with reference to this sensationalism which this pandemic or the information is creating, is going to really cause a lot of problem in general, but I think the resilience which the population has got is going to see us through. I think with this, I will probably stop here and probably pass on to the next panelist.
Okay. Thank you, Dr. Chandrasekhar. So it's very interesting to look at different perspectives. While Professor Bamra was talking about how only 1/3 of the elders have actually been going through, the concerns as in feeling really lonely and not having to meet their family and things. I don't know. I wonder if it is, the difference of being in the UK and India, and we'll probably bring some more light to it, how cultural differences and the geographical difference and the support system also kind of varies, and how that can bring a change in the mental health. And Dr. Chandrasekhar was speaking about the resilience, the cautious optimism, and the different stages that we should accept that we are going through different stages and positively move on. So it is. You spoke about dementia, especially. I've seen even some questions where people were talking about. I think there's an expectation from the elders that this is a quite a serious condition. If you get infected, it's a problem for us. So from the family as well, I think there's an extra pressure that the elders look after themselves really well. They don't go out. They don't put themselves in danger, because if they did, not only are they putting themselves at risk, but also the rest of the family, which has its own, different implications. So thanks for that. So as you did mention that, there are various comorbidities, and I think every person needs to have a proper understanding and take advice from their physician. And I think that is where we'll ask Dr. Jayachandra to step in. So Dr. Jayachandra, we would like to understand some insights into actually, the COVID-19 symptoms in itself, and what are the symptoms we really need to be concerned about, especially keeping in mind as to today's news where things are opening up, the unlocking has started, and the socializing is going to start, and people are going to be interacting a lot more in this kind of situation. How should the elders protect themselves? What precautions should they take? Because I had few friends who were asking, like, well, I really would like to go walking in the morning. I try to go early in the morning, so I'm not, exposing myself to many people. And I believe that that's probably, helping my immunity and so on. So it would be really helpful to understand, where do you draw the line? How do you keep yourself active, equally not kind of putting yourself into danger? So basically understanding what are the essential safety measures, what are precautionary, and, what are optional, please.
Yeah, I think the first thing that we need to really look into is what kind of symptoms that you would get with the COVID. Now, the main thing that you're looking for is that it's like a viral infection. One second, there's something else popping up. Okay. One second, just give me a second. I'll see if I could. No, somehow I'm not able to get my slides on. Anyway, it doesn't really matter. Now, it's just a viral infection, so it would affect everybody the same way. Like you could have an upper respiratory tract infection, you could have a sore throat, you could have a mild cough, or it could be a significant hacking cough. The other thing would be breathlessness. For a person who's able to walk, say, about half a kilometer, he suddenly feels that he is not able to do the same thing. Fever is one of the symptoms, but it need not necessarily be very high. It could be anywhere between 99, 100, it's like that. Now, the entire spectrum of symptoms that you would normally see in any adult. Now, this we have to look at it when it comes to people who over the age of, say, 65. Not all of them present the same way as a younger person. The temperature may not be that much, they may not be reacting as well to the virus. So they may just come with a little confusional state. They could just come in with a mild fever or a mild cough. Maybe he's a little confused. So these are the kind of things. The physician is the right person to assess where we need to investigate for a COVID. Now, every viral infection is a potential COVID. So we will need to investigate the elderly, particularly, to see that they are not infected with this particular virus. Now, it becomes more important for us because these people, at least a majority of them, tend to have a lot of other comorbid conditions. It could be a diabetic, it could be a heart patient, post-surgery, it could be a renal patient, or he could be having a combination of almost all these things. With all these things, I think with the lack of testing facilities that we have, so a clinical assessment at this point of time, at least in our country, a clinical assessment seems to be very, very, very important. Unfortunately, what has happened with the pandemic coming on, most of the hospitals are shut. They're not looking into patients. Most physicians are on leave. So an elderly person is unable to go and see his regular physician. This adds on to the problem. So what we require right now is a proper assessment, especially with the elderly, a person who's experienced enough to assess, even with the lack of symptoms, that you're dealing with a potential COVID patient and investigate them. Investigations are paramount, especially in the elderly, to rule out this particular condition because he may not present with the conventional signs, symptoms, and signs. You may have to resort to an X-ray, you may have to resort to a high-resolution CT scan just to see what's happening in the chest and go on like that. Now, the other thing is, how should retired elders take precautions? Now, this is for everybody, except that the elderly are more prone to get affected and more likely to have a more serious or a more morbid this thing outcome with the whole thing. So you need to be extremely careful. So even the governments have given out recommendations that all the elderly have to stay at home, do not get exposed by going outside and all that. Confine yourself to the room, blah, 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 all that. Don't go out for a walk and other things. All this is fine, but the thing is the amount of misinformation being spread on the TV day in and day out has resulted in a certain degree of paranoia, even among the family members, that they are going overboard with their precautions. They don't let the person come out of the room. They just confine him there. There's nobody to talk. The children are not allowed to go and talk to them. They're totally isolated. I think we need to make people understand, put things in perspective, that social distancing and mingling with people who have had outside contact is to be definitely enforced. Make sure that it is not happening like that. Don't let them go out initially, but as things are slowly getting a little better, going out alone for a walk in the morning in the this thing without anybody around or with social distances is perfectly okay. There's nothing wrong with it. Sharing the dinner table with all your family members is perfectly okay. You're not going to be catching this COVID sitting with your family members, especially if they have also been isolated or have been in isolation. There is really no risk. And particularly if you are talking about people staying in, say, any kind of a institution, if you have ensured that all the inmates have been tested and they are negative, all the caretakers are negative by test, there's no reason why they can't be sitting together in a hall and watch TV together instead of trying to isolate them completely. I don't think that is really required. There's no call for doing all that. I think if you follow all these measures, a significant degree of care is taken to prevent the disease itself. So I don't think we need to go overboard. There is no such thing as 100% prevention unless you're wearing a astronaut kind of a suit. You cannot really prevent that kind of an exposure. But a routine saying hello to a person from about 2 meters distance is not going to be very risky for any of these people. So I think the paranoia has to be removed. Things have to be put in perspective so that people understand. Everybody is scared out of their wits. I don't think that is so, especially for the general people. I mean, if you're talking about people below the age of 60, what kind of a mortality are you talking about? You're talking about 2% mortality, which is much less than an influenza. So why the paranoia? We need to put things in perspective. Even if a younger person gets it, he's going to get out of it like any other viral infection. Elderly have to be protected because they have a much higher mortality and other things, almost to 20 to 30% mortality. So yes, you need to take special precautions for elders. But that doesn't mean that lock them away and throw off the key. That's not the answer either. I think all of you agree that we need to put things in perspective. Social distancing, certain amount of isolation, but all people tested who are negative, who have all been together in a family, can still sit together and still share a dinner without any additional risk to the elderly.
Okay, that's fantastic, Dr. Jayachandra. I think that's there. That question is always there because many of them have actually asked me things like, can we go for a walk? Can we go within the community? Because, as you know, most of the things like parks, gyms, swimming pools, all those are closed anyway. And even not only elders, even children are kind of isolated because they're not allowed to go and play with the other kids. So it does help having your perspective that yes, be careful and be cautious, but don't have to go overboard. Don't have to completely isolate yourself. Do what is basically required for your own fitness. And the very good thing about the stigma that you have touched upon, we will be discussing that bit later as well. So there's no harm in all your, all the family members sitting together in your room, having lunch, having dinner. Please do not, leave them aside, because that just worsens their isolation and might, actually lead them to depression. That's great. Before we go on to the second round, Samir, can you please mute everyone now? I think we are having some more background noise here. Okay, thank you. Can you also unmute the other panelists? Great. Okay. So we'll move on to the second round. My next question is again to Professor Bamra. And what I would like you to address is, focusing on the ideal mindset, really. I think we've touched a little bit on it in the other discussions. But what is the ideal mindset that people should have? We've spoken about different subgroups, obviously. So maybe focusing on the people who are actually living alone, and you can give us different perspectives, maybe about people in nursing homes and, probably people staying in their own homes, and what they should be doing, and what are the support services that they could access. Obviously, you can speak about the UK, but because you've also been coming very frequently to India, if you have a perspective to that, it would be good to know that. And people who are not retired. So obviously we've taken the age group from 60, and many of them are still working. And I think even in 70s, there are a good number of people who are probably into businesses, finances, and so on. So what should those people who are actively, kind of functional, and, how should they think, and what should they be thinking right now? Can you please tell us?
So thank you, Daljeet. Can you hear me?
Yes, we can.
Yeah, that's clear. Okay. So I thank you to the other panelists as well, because obviously we have some common problems across the world, actually. It was interesting to understand the perspective from two specialists in the field. I think what is very important is what Dr. Jayachandra said about, let's take the panic out of the situation. And I think he said, or Dr. Chandrasekhar, one of them said about the news. There's everything, there's a lot of fake news around. There's a lot of negativity around. The most important, and when you're stuck in your house, you are captive to the news media. And what they feed is negative news, unfortunately, because there isn't the distraction of sports. There's no cricket around, there's no football around. So you are just captive to the news 24/7. We are in a news frenzy. And much of it is negative, and much of it, that does impact on the elderly. I know a lot of my patients just switch off the television now. They don't even switch it on for good news. They don't switch it on to watch the old movies from the past, which would make them happy. The most important mindset is, I can still hear background sound.
Can the participants please switch off their audio?
Yeah, I don't know if admin can just switch off everybody except the panelists.
I think he's doing that, but once he unmutes us, I think that control is lost somehow.
Okay.
Yeah.
So so as I was saying, I think positivity is very important. So on Thursday, I did a YouTube conversation with Sadhguru, who's very well known. He's got a different mindset. He does, whether you believe in him or not, what he does is he talks about positivity. He talks about general things, but in an intellectual way that makes it easier for people to understand. I didn't know about him until I had that conversation with him. Then I looked into it, and we need positivity, and that's what older people particularly need, because stuck in the house with your depression or your anxiety, you haven't got those usual kind of social conversations that you can have, the social contact you can have, hugs from your grandchildren. That's the most important thing. Now, what about the good support system? Well, the best support system is your system of family and friends, which, as I was saying earlier in my introduction, is somewhat lacking if you're living in the UK. Even Indian families in the UK, many of them are becoming westernized. And one of the drawbacks, side effects of westernization is the breakup of the usual family system. You know, I'm very lucky because my mum also lives with me and I have a good network of family, but not everybody's that lucky. Your best system is that. But of course, in the UK, people rely on your social system, your social services, your National Health Service, your statutory agency. There are lots of phone line, 24/7 phone line systems, such as the Samaritans, if you're feeling stressed or depressed. So you can call them as well. And so a lot of people have been trying to use those systems, but of course, you know, there's only so much you can get out of them because you get more out of that physical component. Of course, we're in a different cycle in the UK. I'm slightly.
Just a second. Samir?
So thank you for that. So I think maybe if everybody's muted and then the panelists can unmute themselves, then that would be better. So that is a real issue, because you know, these systems might be, telephone line might be available, but it's not quite the same. And if you have a crisis, you can't call your son to come and see you because they might be COVID infected. And we're in a different place in the lockdown. And also, UK, as I was saying, has had the highest rate of deaths, a lot in the elderly, you know, 40% in the elderly in care homes. So that is all care homes have been completely locked down. Family cannot visit them. A lot of family cannot even do video calls because the carers have been infected as well. So that is a real challenge because families can't call people up. In care home situations, it really is just very sad in the UK. And as I was saying, we have a large proportion of our elderly people who live in these accommodations. So the professional carers can't take the phone to the patient and have a conversation because they fear that they might be passing infections on. And what about those who are not retired? Well, we know that people are working well into their 70s and 80s now in the UK, many of them very, very fit. I think the most important thing here is a healthy mindset. You know, a healthy mindset is no health without mental health, having that time to have physical exercise. I don't do yoga myself, but I know I should be doing. But I advocate it in my patients, even older patients. You'd be surprised, yoga has really taken on big time. They do yoga, they do all the stuff that we as Indians know very well about yoga and meditation and that sort of thing. So I think all of that really forms that ideal mindset. Thank you.
Thanks, Professor Bamra. I mean, it's quite interesting, as you mentioned about the yoga. I mean, I think there has to be some study done as to why do the psychiatrists not actually implement what they preach? Because I'm, again, not someone, I ask people to go meditate and yoga, but probably I don't do it.
We should do it. In fact, when I was medical director at my large trust in Manchester, I wanted everybody to do half an hour, all the workers, all the mental health nurses, all the psychiatrists, everybody come in half an hour session, do half an hour's yoga, and then start your day once a week.
Yeah, I think if it's put out of...
Probably the pulmonologists do it all the time, you know. That's why they look so relaxed.
You'll have to unmute yourself for Dr. Jayachandra. You're on mute. You have to unmute it.
Okay.
Yeah.
I wish that was true.
Okay. But I'm really surprised, Professor Bamra, to know. I mean, I did know that at nursing homes, they've been locked down and all, but I really did not have the insight that they were not able to take calls and video calls. I mean, that's really extreme, isn't it? I mean, a really bad
It has
state
to
for
be
them.
done.
Yeah, yeah. No,
It's
I'm
really
just saying.
bad.
Yeah,
Yeah,
yeah.
it
It's
is
really
really
bad for
bad. In some
patients.
homes, it's really bad
Yeah,
in that way because, obviously they're trying to, because of this massive
yeah,
epidemic of deaths
yeah.
in these homes, they've had to take drastic steps.
Yeah, I understand it's for everyone's safety, obviously, but they
Yeah,
just didn't realize how, this whole pandemic is affecting people in different ways. Thanks
indeed.
for that. So we'll go to Dr. Chandrasekhar for the next question. So we've spoken about social distancing and how that has affected. I think we've touched upon it a little bit, that how people are isolated. I've heard a lot. I mean, in Indian context, obviously, you got to, even if the family, I mean, the parents or so or grandparents are staying separate, still, I think the regular trend is your families come to meet them once a week or whenever possible, and they get to see their grandchildren and also often, and that really keeps them going. But all that has kind of stopped now, and I think that's affected people really bad, and there have been lots of calls and discussions around that. So if you would highlight on that, and
Yeah.
also yeah, I think it's both the questions go around the same topic there, how this
Yeah.
restrictions affecting them.
Yeah. One of the uh, things which we found in the last few months is that the concept of social distancing, especially in the Indian family context, people, parents living and their children living in the same city did not have access to each other, live alone across the cities and across different states of India.
Yeah,
That was one issue. But I think there is another positive thing is that still a lot of elderly do stay with their family members in the same house. And having said that, in those instances, at least some of our elders already are tuned to this concept of staying alone, because in a significant number of families, we do see the children staying abroad and the parents staying alone in India. This sort of a situation is not unknown. But what has complicated the whole thing is that the difficulty in visiting these people physically. As the pandemic is spread across different countries, even those children who wanted to visit their parents, if they are sick or they have some other urgent matter to cope with, they were unable to do it. So this puts a lot of physical and emotional sort of a stress on the elderly. So how do they try to cope with that? One of the ways probably they were coping or they do cope with it is by frequently calling them. The limitation here again is that in terms of calling, either a video call or an audio call or Skype, whatever it is that a significant number of elderly or do have certain physical problems like unable to see adequately, unable to hear adequately, and this puts again an additional limitation in their ability to reach out to those people who are at a distance. Another important thing is a significant number of them may not be that tech savvy. So they need an assistance to help them to connect or any of these electronic media, and that is lacking in these times. So a lot depends upon the situation in which these elderly are put. So this restricted mobility to them um, has put a lot of limitations the way they are able to sail through their day-to-day routine. One way of this, getting over this sort of a problem, which we were suggesting to some of the families, is that see that if possible, there is some sort of a involvement of the local communities. There are certain volunteer groups who will assist these elderly, go to their place and help them in their daily course. There are certain volunteer groups which can be motivated to do this, and this is how probably one has to cope with the situation. Other thing is some limited physical activity in their own surroundings. It could be minimal exercises, minimal bodily exercises. Even sitting on a chair, one can do some physical activity, like stretching their legs, stretching their hands, especially if they're too old to move around. And these sort of a simple exercises can sometimes help them to become more mobile. Another common thing which we suggest to elderly is that sort of a breathing exercises to help them to relax. Simple breathing exercises can sometimes help them to relax better, improve their sleep, improve their coping abilities, and of course, uh, the improving their immunity by way of a good nutrition is also a thing which is required in these times. So, social distancing, as far as the elderly are concerned, has put a lot of limitations in their approach to the others. I think we have to, I think it is not uniform for every family, it is not uniform to the entire community. People have to find out some innovative solutions depending on the situation in which they are staying, depending on the environment in which they are staying. And in the Indian context, probably this has not produced so much of impact, in my opinion, because I do understand that still significant number of people do stay with their families. Thank you.
Okay. Thanks, Dr. Chandrasekhar. I would just like to touch upon that thing which you mentioned, which I've seen in many of the friends and families as well. So people are probably staying quite close, within the same city. Parents are in one house and the children are in other. Now, some of them are casually going and meeting their families and, having at least weekly dinners and all together, while some staying really close are not meeting their elderly parents. I don't know if it is the anxiety that, they've been going to supermarkets, because obviously everyone was locked down. So I don't think they were all going for their jobs. But if they're going to supermarkets or exposing themselves out, and then with that fear, they were just not going and meeting them. What do you think? I mean, I guess you won't be able to say what's right or wrong, but what would be the right approach to that?
See, I think still probably if taking adequate precautions, I don't see any reason why they should not visit. One has to take adequate precautions, whatever is suggested in the way of masks or some face shields and all those things, basic hygiene measures. I think probably elderly need support at this time, not isolation. And how best we can give that support in the current circumstances is one thing which has to be approached. Like I said, each situation needs an innovative approach.
True.
I don't think we have to be too adamant, too strict with our approaches.
Yeah.
That is the reason probably slowly these lockdown measures are being in some stages.
True.
I think a strict of a discipline, I don't think is necessary in these instances.
Okay, that's great. Thank you. So I think we'll kind of move on to Dr. Jayachandra for the next question. Again, we are kind of revolving around the same panic, but probably which sometimes goes extreme. I think, yeah, Professor Bamra mentioned earlier, he had someone coming to the hospital saying, "I'm feeling so anxious. I feel like suicidal." And I think that's what I've put in this. We've also heard in the Indian media that people have committed suicide because they were so scared. When in the elderly group, they have actually committed suicide because they were scared of getting the disease. So one is that thing that we would like to discuss. And second is because of your specialty, people who've already got pre-existing physical health conditions, what kind of approach should they have, and how, should they deal with this situation? Briefly mentioning about the, work at home, because even today when I was reading, there was some article as in a 78-year-old lady, managing all the household work. And then someone also mentions about my spouse has a stroke and we've got no help now because of the lockdown and we are having to do all the manual stuff manually. So these are the areas if you could, give us some insight.
True. It's very interesting saying that, when Dr. Bumrah mentioned about a patient coming in with suicidal thoughts, the best way that he helped him was by talking to him and treating him and putting things in perspective. Now, most of the time, when an elderly person living by himself, has no information and is watching the TV, he is getting into a panic mode, he has nobody to get in touch with, either his physician or his family or anybody else. So he tends to go on to take the extreme step. Now, what we have done by talking so much about the pandemic, day in and day out and day in and day out, about saying COVID and COVID and COVID, I think we need to also give the positive aspects of this disease, that even if you say 30% mortality in the elderly group, we need to put it across a little differently, saying that nearly 70 to 80% of the people are recovering with this disease in spite of having this disease, even in the elderly. I think this is something which has to be conveyed so that people do not hit the panic button. Most of the time, I think whatever is happening is because of the fear of the unknown. I'm sure I'm talking to the wrong people and psychiatrists here. But the thing is, the fear of the unknown puts so much of pressure onto oneself that sometimes one goes overboard with their reactions to reacting to this particular thought of this disease. So I think that is extremely important, that we need to have more positive information coming in for these people. We should have more, more talks on TV saying that, oh, don't get so panicky. It's okay. It's not so bad as yet. You could get it. You will still recover. I mean, some kind of a things like giving stories about who has recovered, how he is okay, how a 85-year-old lady from Kerala recovered from the whole thing, walked back home. I mean, these are the kind of story that you need to emphasize and tell people, saying that, listen, it's not as bad as you have thought it. It is. Now, as far as elderly people getting burdened with housework and all that, we have so many people who are living by themselves. And as Dr. Chandrasekhar also mentioned, that the children are somewhere abroad, they're unable to come here. They're very well provided for by way of finances and other things. So they have 2-3 maids coming in, looking after their cooking, the cleaning of the house, and everything else is being looked after. And suddenly this COVID comes and everything closes down. All societies say no outsider can step into the apartment complex. Now suddenly you have left these people in the lurch. They are not used to it. They do not have the physical capability of looking after themselves. They do not have the capacity to cook for themselves or fend for themselves. Now, what do? We do not have nursing homes which will look after people like this. They can afford it, but they do not have help. I think somewhere we need to have that kind of a margin, that elderly people need to be looked into as a different group which requires special care, and some kind of an exception has to be made for these people so that they are given at least one person walking in to do their job and going off. I think that is something which has to be done. Like as Dr. Chandrasekhar mentioned, saying that there's one elderly lady looking after a completely bedridden patient, doing on the household work, cooking and everything. Come on, I mean, one could do it for a day or two, but on a sustained basis, I think you're going to have 2 bedridden people. So I think we need to have a more humane approach to whatever we are trying to lock down and other things. I think we need to consider all these things. We cannot have a totally bureaucratic approach to the whole thing, saying that, no, this is the way you need to shut down. You can't shut down like that. You can't shut down on people. You can't shut down people and leave it to themselves to live or exist by themselves. That's going to be extremely difficult. I think that is what we need to look at. And as far as the mindset for elders who have physical disabilities, well, you can't escape any one of those things. So you need to be feeling more positive about the whole thing and say, okay, I have to accept that I have the physical disabilities, but I need to get on with my life. I think most elderly people who are living by themselves with physical disabilities, even before the COVID has come in, I think they're all quite mentally attuned to the fact that they have to exist by themselves and then they need to take care of themselves. Most of them are doing okay. It's only the people who had help and suddenly the help disappears that they are totally feeling at a loss. They don't know what to do. And those are the kind of people who tend to have significant degree of depression, suicidal thoughts and other things. I'll stop here.
Okay. Thanks, Dr. Jayachandra. As you were saying, I was just thinking somewhere, I think it's the responsibility of us as professionals that we kind of, share this message with the community, how the elders should be looked after, whether it comes through media or so, we don't know. But as you said, media has only been showing a lot of negative stuff. So if, we have celebrities, we have professionals actually going on media and saying, these are the struggles and difficulties the elderly are facing, and we have to keep some margin for them. I think that is where we all can start working on. Thank you. Samir, I would please look into the audio part. Thank you. Right, so I'm aware of the time. What we'll do is we'll have a quick discussion for another 10 minutes, and then we'll take questions because we're on chat. So, Professor Bamra,
Yes.
I think we can go a bit faster.
Yeah. Can you mute?
Have to wait.
Can
Samir,
mute this person?
can you please mute everyone, and then we'll just unmute ourselves, I think.
Yeah. Okay, is that okay? Can you hear?
Yeah. So
Okay.
as the question is really, we were talking about how retired elders in the UK have accommodated. I think you've already touched upon the nursing homes and maybe speak a little bit about the old age homes. Sharing due to the cultural differences, if there's anything more you feel you need to add in terms of UK India perspective, we would like to hear that from you. And if you can give some takeaway message for people on positive thinking, that would be great.
Yes, so I agree with my fellow panelists that, I think that there's so much fake news around. We just have to, older people are not stupid, they're not daft. We give them the right information and then they can make the choices. And if they make the choices, then, hopefully on the whole, it'll be fine. What we know from the UK is that we expect that 90% of the population is going to be infected by the virus. At the moment, only 80%, will be infected by the virus. 20% have been so far affected. 90% of people will suffer nothing from the virus. The virus will come and go, and nobody will be none the wiser for it. So it is a small number of people who are going to suffer very badly from them. But different countries need to approach the problem differently. So you will know that if you're a healthcare worker, if you're an African, Indian, Pakistani, Sri Lankan, working as a doctor, you have a high risk of death in the UK. It's all over the world. We've done a lot of work on this as Papio. And there are particular risk groups. And older people in care homes are at a particular risk as well. I mean, the virus in some ways exposes some discrimination within. The virus is not racist, but the virus exposes some discrimination within our communities. And older people living in care homes have been disproportionately targeted by the virus. I mean, it's so sad because children can't go to their own father's funeral or their mother's funeral. It is really quite tragic. We will remember this time as being very stressful for many of us for the wrong reasons, unfortunately. But I think if you look at the other picture, which is that, so if we know that these are the people at risk and we need to shield them, we need to protect them, then the rest of the people can go on as normal. Now, you know that India has started flights from here. We're supporting a lot of lab doctors who've come from India and have got stranded in the UK. So we've collected money and we're supporting them in Salford University. Some of them are going back to India in the planes, and they tell me the planes, they have social distancing, they have complete protective clothing, they have shields, visors, everything, masks, everything. So I think that you can do both things, is ensure that we have some kind of normality, that positive message important for that group of people to say, look, we can go about our normal business slowly. But I think we still think even in India, social distancing is going to be important, even if you work. So But I think generally, I think I agree with the panelists that we have to be realistic, give people right, intelligent choices. Thank you.
Thanks, Dr. Bamra. While you mentioned that some of them are actually not able to attend the funerals of their parents, but there's also another extreme where we've seen in India that parents have died probably due to suspicion of COVID or actually ended up having COVID and have been hospitals, but children have refused to pay the final rites, and it is something I think is a question for the other panelists that I would be taking.
Can I just make one point which we haven't
Sure.
touched on, Daljeet, which is the stigma of this virus. So I know a surgeon, young chap, who got the virus, no symptoms, asymptomatic, but he tested positive as part of the procedures. He didn't want anybody to know because he thought, well, look, what will people think about me, And, I said, well, look, we've got to think about contact and tracing and that sort of thing. But really nice guy, very intelligent guy, very hardworking guy, very compassionate guy. But there is a bit of a stigma around this, even for people who haven't got it, but certainly for people who've got it.
Yeah.
Thank you.
Thanks. Yeah, and it's, I guess, a lot more here. We have even the students, medical students and all, some of them have not disclosed. So there's been a lot of cases coming up where there have been suspicions but not disclosed, and now they're having to go into quarantine. So I'll take the next question for Dr. Chandrasekhar as to maybe the first question we kind of touched upon, whether the elders feel if they are not able to contribute to, the society and emotionally and physically, does that make them hopeless or so? But for me, more interesting would be to know how the elders in the rural and urban areas, is there a different pattern to the way they've been coping? And also, I would like to touch upon, any gender differences. Have you seen how, male of the same age group are managing it different compared to females?
When you look at the rural-urban situation, I don't see much of a difference in that sense, because there are certain rural communities where we go near our rehabilitation center. In fact, all those villages themselves put themselves under close supervision and social distancing themselves. They are adopted very well. Now, once the message has gone to them that is an infective process and they need to be careful, I think they did take the same precautions as urban people did. So there was not much of a thing in terms of a gender difference also. I don't think there's much of a thing to it, except that the ladies at home had to share a lot of domestic work. And because, as someone else was mentioning previously, because there was no external help in terms of getting the maid servants or someone else who used to help them earlier, they had to bear all the brunt of the work. The second aspect, as I said, the feeling of guilt and dependence is that, see, a lot of people, I think, most of us would have to agree that within our own limitations, taking care of our own health, we need to help those people who are in our surroundings. That removes a lot of guilt. It could be as simple as helping your own ex-servant maid, as simple as that your employees, taking care of your employees. These are some of the things which all of us can do to see that we contribute something to the situation. I'm not saying that we're contributing to the COVID-19 in that sense, but we are contributing to alleviate the suffering in the situation. It may be helping your employees, helping the servant maids, or someone who is needing some help. So the concept of sharing removes a lot of guilt from our minds. Other thing which we did, especially on behalf of our ARDS, what we did was, as soon as we knew that at the initial stages of the lockdown, no one was allowed to move or travel within the city. So we took a permission from the Social Welfare Department, made them issue a circular to the police department saying that there are people, elderly people, who need personal help in terms of paid carers, and also people with dementia who need paid carers, and they should be permitted to travel to those houses. So the police issued passes, special passes for them. This is how we could really help the situation. So what I think is from our side, from anyone else in the community, is that how to help the situation so that the people will cope up with the situation in a better fashion. I think that is what maximum we can do.
No, that's
Thank you.
great. I mean, it's good to know that the police were supportive and they have given passes and made exceptions for, people
Yeah.
with dementia and other disabilities who needed help. So it's really good to know that. I mean, keeping in mind that we've got three panelists who are males here, maybe you can give some advice to the elderly males at home as to how they could help their, spouse. Because I have actually literally heard this from few of my friends. When the maids and all have stopped, their parents, they just see the mother working all the time and the fathers are actually not doing much and just sitting with their newspapers. And I was like, well, so I think as professionals, maybe that is a message we could even share today, if you think so.
It can't happen in the UK.
Yeah, but we have to bring it in India. So Dr. Chandrasekhar, you want to advise something to people of Hyderabad?
I think probably the younger generation, this is there, I think, helping the spouse in terms of household work. Most of the younger generation does that. There's only probably certain older generation of my age group and above probably have got used to that, not helping too much in the household chores. I think at the time, I think majority of them do put in their effort, at least in terms of the cleaning, if not cooking, at least cleaning the household and not giving too much of a burden to the spouse.
Yeah,
I think we have to do that. There is no other alternative. Our lifestyles, our habits have to change. I think this COVID pandemic is going to bring that. Most of us have to be much more self-reliant in terms of household activities.
Thank you for that. It does mean a lot coming from senior professionals, because I think it's time for change, and it's about being mindful and being kind to everyone around you and taking on some responsibilities.
But there is a very important point here, Daljeet. I think we men, particularly Indian men, are in that mindset. I have to say, even in younger people, there is that mindset. And they have to change because life is changing around you. But also, if you look at the statistics around this virus, if you look at Wuhan, 70% of the people who were killed were men. There is a message for men here that, look, you've got to be more active. You've got to take better control. It's just not just work. So I think there's something another positive message from this seminar.
Thank you, Professor Bamra. So Dr. Jayachandra, this is the last question, and then we will be taking questions after this. Professor Bamra was already, talking about the stigma, but that is something I wanted to put to you. And I also mentioned about this, funerals, and also how far do we go? I mean, I know of people who are so scared just to contract COVID, because it's different in the UK. Obviously, in India, you got the government hospital, and the fear of actually ending up in a government hospital with very minimal facilities kind of makes you more anxious than actually the disease in itself. So that's no true. I mean, there's so many discussions. So can we talk a little bit about the stigma associated with it, and then some final advice on the immunity that our elders could build up, if at all, at this age?
See, as far as the stigma is concerned, there's very little you can do immediately, because that's going to remain there. And till it percolates in the society that, come on, it's just a viral infection and there's nothing it's not like HIV or something like that. He has not done something bad, if you could put it that way, that he's got this disease. It's just a viral infection, just about anybody could get it. So there need not be, or there's no reason for a stigma to be attached to this. But the message to be percolating down to all members or through the societal thing is going to take time. Except that, every time a person comes to you with a probable COVID, as physicians, probably we can always deal with it, as a matter of fact, saying, oh, this is only a viral infection, there's nothing to be done. You don't have to say that, oh, isolate him, he's got a bad test, he's got leprosy or something like that. No, you don't have to do that. I think we need to put things in perspective. And there are no ready-made answers to this. It has to percolate down, and people have to be told if somebody is behaving atrociously, like not trying to take up their parents' body for cremation also because of the fear of COVID, I think that is carrying things a little too far. I think somebody needs to be there, put some good sense into their head saying that this is not the way to go about it, because there is really no risk attached to this thing. Wherever the COVID death occurs, probably in a government institution or wherever it is, those people would have already taken the necessary precautions to process the entire body, if you could put it that way, before handing over to the next of kin. So I see no risk of that disease passing on to others because of that. So I think it is frankly some degree of idiocy when they say that we don't want to do this, or absolute ignorance. I mean, probably that's the other word for it. I think you need to put it across that this is not the way to go about it. There is nothing to be ashamed of for getting a viral infection like a COVID, not a big deal. As studies have proved that almost 90% of the people are okay. Come on, in the worst of situation, probably 2% to 3% of the people are really having a major thing. Put in another 3% who will still have some lasting side effects because of the disease itself. But the majority of them come back normally as if nothing is affected. So I think ultimately, we are all going around the same thing. This misinformation, this total, deluge of negative news all through the day, 24/7, I think that has to stop. I think we need to put things in perspective, saying that just a viral infection, yes, it is contagious. You need to take care. You need to protect your elderly, no doubt about it. But then put it in perspective. Don't go overboard with your suggestions, talk shows, breaking news, blah, 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 blah. I think we need to concentrate on more the positive outcomes in people, even in the elderly, to just emphasize that this is the fact, this is the reality. We need to have a reality check. I think that is what is more important.
Okay, that's great, Dr. Jayachandra. I mean, I think there are a lot of takeaway messages from this webinar that we've had. I mean, there has to be, the attitude has to change. We have to bring a change in our lifestyles. Stigma has to reduce. There's no reason why someone probably ending up with COVID-19 should be stigmatized, or even the suspicion, in fact, that people shouldn't hold any stigma against that. So there's so many things. I was kind of going through the chat to check if there were any questions. Really kind of you, Professor Bamra, you probably answered most of them alongside, which is really helpful. Just for the benefit of others, I think lots of questions where, if the children are settled abroad, how do we manage here? And how do we maintain social distancing? What should people do if they end up with anxiety? So I think maybe a little bit we can touch upon, we've spoken about people with pre-existing mental health problems, but yes, due to this whole COVID crisis, some people might have developed anxiety. What my own experience has been that people who were on the borderline have actually, if they're pre-morbidly, they were anxious but did not need medication or so, now suddenly have found themselves, with these anxiety symptoms. And probably for those people, we've had to start some medication. So if you find yourself in that sector, please better consulting one of the doctors, because I don't think we should just go and buy anything over the counter. Please consult a psychiatrist or a physician, and they should be able to help you. There are also a few questions along the physical health lines, as in, many of them do have diabetes and cardiovascular diseases, and it's very common in the elderly to have those. How should they manage that? There's a question about the diet, though I don't know who would like to take on that. I think this is something we've not covered. What should the ideal diet be, and if there are any ways where we can increase the immunity? Dr. Jayachandra, would you like to take on that if possible?
There is no specific diet that you would prescribe for any of these people. I think basic thing is for the elderly and all that, most of the people should have their regular shots of, influenza and pneumococcal vaccines and other things which is part and parcel of their normal vaccination schedule, especially after the age of 60, 65. The recommendations are all there. I think they should take that. Physical activity is another thing. Make sure that all the comorbid conditions that they suffer from are under good control and they're being looked into properly by their physicians or specialists, whoever is looking after them. I think that should be done. I think a regular walk or some kind of an exercise is going to be a great help in toning up their immunity in a lot of ways. Being sedentary, not doing anything, and more than anything else, a very negative attitude somehow always leads to a very poor outcome with any disease. So I think talking to you people, I think the message is that you need to have a positive attitude all the time. In spite of having multiple comorbid conditions, there's no reason that you need to be feeling low all the time. You need to have a positive attitude to life, and that itself is a big immunity booster. Diet and other things, yeah. I mean, I'm sure at the age of 60, 65, nobody is eating junk food and all that, at least not to a large extent. But most of the things, as long as you're having a very balanced diet and looking after yourself and with all the other supportive things like exercise, I think that's the best you can do under the circumstances. What else could you do really at this point of time?
Okay, that's great. Thanks. Also, there's something come up.
I think Dr. Mundra has got something to say.
Is there anything you would like to, anyone would like to add on the diet and immunity? Then I'll probably go to the next question. Yeah.
Just one thing that probably may not be true of Indians in India, but certainly Indians abroad in UK and USA. We know that if you're vitamin D deficient, you're more likely to suffer the virus and more likely to die from the virus, it seems. There's data coming out on that, and we'll wait to see the whole data because it's a very complex area. So vitamin D deficiency, because we don't get so much of a sun, is very important to correct, in particularly abroad. I think this might be an Indian thing because of our brown skin, but I'm not quite sure whether that's much of a problem in India.
Right.
I mean, sorry.
No, go ahead.
I was going to give you some, just give you some very quick top tips, if I may, Daljeet.
Yeah, please. I was going to, I'll just probably interrupt you here. If there's anything more to be discussed on this topic, we will. If not, at the end, I would want everyone to give some takeaway message to, our participants here.
I'll come at the end. No, that's fine. But in terms of diet, we should stop eating those laddus and jalebis. I love them too, But listen, come on, let's have a good diet,
And most of the elders actually like to have some meetha after their lunch or dinner.
Oh, they like absolutely. They have to have their rasgullas and they have to have lunchtime samosas and pakoras and all that sort of thing. Oh my goodness. Okay, have them, but have a treat at the weekend rather than every day. I love paranthas, aloo wala paranthas. No Punjabi can live without aloo wala paranthas. I'm learning to live without them.
Okay, great. Sorry, Dr. Jayachandra, were you saying something?
I don't know. I just lost the link. It's okay.
Okay, that's fine. I'll come back to all of you.
One second. The point was about vitamin D. Yeah. We see a lot of vitamin D deficiency here too. We don't know for what reason, in spite of our exposure to sun and all that. In spite of that, we see a lot of people who are deficient in vitamin D. Yes, it does have an adverse effect on a lot of other diseases also. And supplementation, yes, is part of the treatment which has to be looked into. That's
great. Thank you. There's some interesting question here talking about, demanding removal of coronavirus-linked restrictions for senior citizens, and the gentleman talks about some kind of, petitions there. I'm not going into the detail, but I think we've already touched on that we're not going to any of the extreme. We are obviously not going to put petitions saying all the restrictions have to be taken away from the elderly. In that case, I think then it becomes a very casual attitude, because we are aware that, the elderly population is at high risk. And if they were to acquire the virus, they probably, it's going to be a bit severe compared to the other population. So I think we'll have to be mindful of that. And I think most of the other things about the yoga and all that's already been covered. So that's okay for the questions. So I really thank all of you all the panelists here for gracing us with your precious time and presence here. I do thank all the participants for coming and being part of this. It has really helped, and this is kind of the first webinar I've organized. So I've also learned a lot through that, and it's been a very interesting discussion. What I'm going to now ask all the panelists is probably give a one or two liner as a takeaway message for all of them from this webinar. And hopefully, if there are any more discussions or any questions that you feel we've not addressed, you can always email me. The email has already been shared, and then, we can get back to you on that. So I'll probably start with Professor Bamra. What would be your takeaway messages or tips that you were talking about?
So I have 6 top tips. I think we've lost Dr. Chandrasekhar, unfortunately, Daljeet. So I don't know whether you want to reconnect him. So my 6 top tips are like this, folks. And it's been great. Thank you, Daljeet. And it's been lovely meeting with my fellow panelists, Dr. Jayachandra and Dr. Chandrasekhar. And I look forward to seeing you guys sometime when I love Hyderabad. I look forward to coming and seeing you. And of course, the audience, who are very, very interactive. So I have 6 top tips. So one is to stay connected. It's very important, one way or the other, to stay connected. The other is that you have to be able to talk about your anxiety. Don't keep it closed in. A problem shared is a problem halved. Look after your physical health. That's very important, because if you don't do that exercise, if you don't go out and have good food, then you're very likely to suffer more from the ravages of this virus, as we know, because it brings in comorbid conditions. Find time to relax, do your yoga meditation, read a book, not watch your favorite Netflix movie. Sholay is the best one. Jab We Met, 2 top tips I can give you. Fantastic films. Just relax you. Don't watch films that will increase your anxiety. No horror films, please. Don't stay glued to the television. I think Dr. Jayachandra said that. I'm pinching that from him. Don't stay glued to the television. And lastly, do things that you enjoy doing and find new things that you want to do, which will encourage you and make you happy. Thank you.
That's great. Fantastic tips. Thank you, Professor Bamra. Dr. Chandrasekhar, what would you like the audience to take away today?
The takeaway message I would give them is that avoid overload of information. Talk to a reliable source, preferably a physician, because it is a disease and he would know better about your health. Take care of your physical health, and also keep a watch on the symptoms of distress, psychological distress, and attend to them if needed.
Excellent. Thank you so much. Dr. Jayachandra, what would you like to add?
I would only say that be considerate for the elderly. Don't wait for them to really fall sick. If you find some subtle changes in their behavior, attitude, or mild fever and other things, probably this is the time that you need to check with a physician. Don't say that we'll wait for a couple of days and see how it goes. I think at least now, in view of the COVID and other things, they merit a physician consultation before deciding what is to be done. I think that is what we need to do. And the rest of it is switch off the television. I think that is the main thing that all of us have to advise all our patients. Half the time is spent trying to explain to patients that this is not true what they said on this channel or on that channel, or the Google said this. Come on, I'm getting sick and tired of it. I don't think we need to just switch off. No more answers on that. Just be positive about the whole thing. Put things in perspective, have a reality check, and get on with life.
That's great. Thank you so much. There's been so much learning, not only for the participants, but also for me today. And so interesting to know, different perspectives. When I was sharing the advert of this webinar, a few of my colleagues were like, can you please find us a solution, for the distress that the webinars are causing us? And I was like, oh, well, I will do after my webinar is over. But I'm glad I did this, because I think, I was really keen on addressing this topic, because I don't think that's being touched upon, especially the elderly. And I guess we could go on and on, because it's such an interesting topic. So thank you again, all the panelists, for your time. Thank you, all the participants. And I think we'll end the meeting here. And hopefully we should be able to share this on YouTube shortly. And if we do so, we'll share, because we got the emails for all the registrations. Thank you. Bye-bye.
Daljeet.
All right. Thank you.
Bye.
Thank
Bye-bye.
you. Bye.